Packed in like sardines, young foreign students all living too close for comfort in small city apartments. It's a health and safety issue at the best of times, but in the current pandemic, these dorms are potential COVID-19 hotspots.
So is it one bathroom?
Yes, for 5 people.
Yeah.
Clearly, these rooming houses are a major weak spot in Australia's response. And if there is going to be community transmission, this is going to be one of the major sources of it.
Apartment slums that could become COVID-19 clusters.
How cheap would you do?
If we're moving in currently because of COVID-19, the price is a little bit dropped.
Okay.
Yeah.
It is the case that we don't want it to flare in areas of overcrowding.
And it's something that we need to move on urgently.
Most Australians are doing the right thing, staying at home and practising social distancing. But underground rooming houses packed to the brim with international students are putting everyone at risk.
Currently, some of them are students. Some of them are working holiday, they kind of like backpacker.
It's difficult to comprehend, but someone has squeezed 8 mattresses into this tiny 2-bedroom place in Melbourne CBD. And they're currently on the hunt for more tenants. Over in this high-rise apartment, things are too close for comfort. 5 girls share 2 bedrooms. So much for having your own space. Bunk beds and shared bathrooms are commonplace. And if you want to escape, well, there's the living room.
So if you want to study, you can study together in living room.
Yeah.
They're ideal grounds for rapid person-to-person transmission of what is a really quite infectious virus.
Dean of Public Health at the University of Queensland and infectious diseases expert Professor Charles Gilks says he's appalled by our vision.
It is a risk for the emergence of community transmission of the virus, and we need to recognise that and take steps to stop it happening.
What makes things even worse, those in the dorms we uncovered aren't just sitting at home. They're out and about in the community, working.
Some of them still got a job.
Yeah.
You can imagine how fast COVID-19 could spread in an apartment complex with all of its high-touch surfaces. If one of these properties has an outbreak, the consequences could be catastrophic.
I very much feel for those individuals that find themselves in cramped living conditions. As a public health issue, it is the case that density of living conditions is a risk for spread of something like coronavirus COVID-19.
Deputy Chief Medical Officer Dr Nick Coatsworth.
So the most important message I would say to any individual that finds themselves in those conditions is if you get symptoms, or if anybody in your dorm or boarding house gets symptoms, that you get yourself tested. It's free, and we need to find out about COVID-19 if it's in those conditions.
Health experts fear we could see a cluster of cases caused by overcrowding like this, similar to what's recently happened in Singapore.
Singapore was held up at the start of the international response to the pandemic as a country that had done remarkably well. It had kept the numbers of cases really low, they were doing a huge amount of testing, and they really were preventing that surge. Now they're seeing a surge of new infections coming from their workers' dormitories, where there are overcrowding and a lot of workers clustered together.
This really is a health problem waiting to happen.
It's the lack of standards and regulation for room share accommodation which makes it such a risk, according to Professor of Urban and Regional Planning at the University of Sydney, Nicole Gurran.
Overcrowding no longer is just a problem for people living in inadequate housing. It's actually exposing us all to the risks of the spread of coronavirus, and this is something that we need to move on immediately.
If someone was to get sick, then yeah, everyone else in the house would probably be vulnerable.
American student Ray Jenkins says he's lived in a Melbourne rooming house and the thought of doing it now terrifies him.
It'd be super scary, anxious. Your parents, everyone back home, they'll be calling, trying to see what's going on. And you're telling them that this is the only thing you have at the moment, and they can't do much about it because of the crisis. And the government here is not really helping us out either. So yeah, for me, I start to think like, who's on my side, who's there for me, who's there to support me in a time like this.
Many backpackers and students from overseas are forced to live in hostels like this one, which are still allowed to operate, although the government has urged visitors on visas to head home.
Okay.
17 people live here and management are keen to fill more beds.
Okay.
When the doctor said that you're healthy,
Yeah.
it means that you're fine.
Yeah.
Obviously, Australian citizens have a range of options. It is more difficult for people that are here visiting.
So the fact that you've identified these really does makes it imperative that the local councils or the states and the cities in which this is happening take some immediate action to close these hostels down and, if necessary, house these people in hotel rooms. They really need to be supported to be living in a safer environment where they can practice social distancing and where they're not a risk for the general population.
The Victorian Health Department tells us it's working with the housing sector to help rooming house operators comply with their legal obligations. If you know of an illegal or unregistered rooming house, let us know by sending us an email. The address is on your screen now.